Welcome to this explainer. If you or someone you love is navigating the whole fertility journey, it can sometimes feel like you need an advanced medical degree just to understand what might be happening in your own body. Today, we're going to act as your guide. We're stripping away all that confusing medical jargon to bring you clear, reassuring insights on female reproductive health, drawing directly from the expertise at ART Fertility Clinics. Our goal here is simple: to empower you with knowledge, because understanding your body is literally the very first step toward making informed, confident decisions about your health. Okay, so here's our roadmap for today. We're going to start with the basic anatomy of conception, explain some common cervical hurdles, and then dive into understanding uterine factors. After that, we'll talk about how to get a clear diagnosis, and finally, wrap up with your actual treatment options. Let's get right to it.
I want to start us off with a really important reminder. It says, a woman's reproductive organs play a key role in natural conception, but the normal working of these organs can get affected due to certain structural and hereditary conditions. If you've been struggling to conceive, take a deep breath. You are absolutely not alone. These physical obstacles in the cervix and uterus, they're incredibly common. They are valid hurdles, and most importantly, as you'll see today, they are highly identifiable.
So, let's start with the foundation, the actual anatomy of conception. You might hear the term uterine factor infertility. Basically, this refers to conditions where the physical structure or the overall health of the uterus stops an embryo from implanting safely or a fetus from growing. Let's translate that medical terminology into a much simpler concept. Think of the uterus as a nurturing environment, right? Sometimes, just because of physical structures inside that space, the environment isn't quite ready to support new life. It literally just needs a little bit of medical support to do its job safely. Moving on to our next checkpoint, let's talk about the pathway itself, cervical hurdles.
For fertilization to happen, there's this amazing natural transport system. Step 1, sperm enters the vagina. But step 2 is really the magic key. The sperm actually has to swim through very specific, nutrient-rich cervical fluid. Only then does it reach step 3, where it's safely transported into the uterus. So sperm heavily relies on the glands in the cervix to produce fluid with exactly the right nutrients and the perfect consistency to successfully make that journey.
And this fluid is absolutely essential. Normal cervical fluid is packed with nutrients and has a very specific, welcoming consistency. But if that cervical lining becomes problematic, meaning it gets way too thick or too sticky, it acts like a literal roadblock. It actively disturbs the transport of sperm, making it incredibly difficult for it to ever reach the uterus.
Now, beyond just the fluid, there can be physical structural hurdles too. Doctors might use the term cervical stenosis. I know, it sounds super intimidating, but let's demystify it. Cervical stenosis is simply a genetic deformity or maybe some previous physical damage that causes the cervix to narrow. It's a physical narrowing of this crucial pathway, which essentially blocks sperm from getting into the uterus. Honestly, it's a mechanical issue, plain and simple.
All right, let's look a bit deeper into the nurturing environment itself and understand some specific uterine factors. There are a few common structural factors that can block fallopian tubes, prevent implantation, or sometimes cause miscarriages. First up, we have fibroids and polyps. These are really common non-cancerous growths. Next are inborn deformities. This just means you were born with a uniquely shaped uterus, like maybe it's T-shaped or there's a septum dividing the space. Then we have a thin endometrial lining, which just makes it hard for an embryo to attach. And finally, Asherman's syndrome, which is simply the presence of scar tissue. All of these are just objective physical obstacles.
Okay, I want to pause here for a second to address a pretty intimidating question. What exactly is a hostile uterus? If you've been researching fertility at all, you've probably stumbled across this terrifying-sounding phrase. It can make patients feel super anxious or even like their body is betraying them. So let's validate that anxiety right now and then completely unpack what it actually means medically.
So, a hostile uterus is really just an outdated colloquial term. It's an informal label for an environment that simply needs a little medical intervention. Usually, it points to chronic inflammation, known as endometritis, or physical things we already talked about like a thin lining or fibroids preventing an embryo from being properly nourished. The crucial takeaway here, we need to disarm this scary phrase. It absolutely doesn't mean your body is actively attacking you. It simply means you have a specific, highly treatable condition that's preventing proper nourishment.
Now you're probably wondering, wouldn't I feel all this inflammation or notice these fibroids? I really want to reassure you here, it is completely normal to have zero symptoms. Most of these uterine and cervical conditions have absolutely no signs until a couple actively tries to conceive and runs into trouble. Sure, some women might notice changes to their menstrual cycle or have some pelvic pain, but for the vast majority, these underlying hurdles are entirely silent.
So how do we find out what's going on? Let's talk about getting a clear diagnosis and finding some answers.
A super common question is exactly when a couple should seek out a formal medical diagnosis. Generally speaking, doctors recommend getting evaluated after 1 year of trying naturally with regular unprotected intercourse. However, if the woman is over 35 years old, that timeline shifts down to 6 months. This rule of thumb just ensures you get the proactive help you need, precisely when it makes the biggest impact.
And when you do go in for a diagnosis, doctors have some pretty incredible tools to see exactly what's happening. A transvaginal ultrasound gives them a really clear, immediate view of the uterine structure. Then there's the hysterosalpingram, or HSG. I know, huge word, but it's really just a test using a safe dye to visually check for blockages in your tubes or uterus. A hysteroscopy lets doctors insert a tiny camera to look directly inside the uterus for things like polyps or fibroids. And of course, simple blood tests are used for hormone testing to check your reproductive levels. It's a very comprehensive, step-by-step investigation.
Finally, let's get to the good news: restoring health and exploring your treatment options.
There are some incredibly proven, empowering treatment paths available to you. For innate abnormalities, doctors can often use a highly safe, minimally invasive laparoscopic technique to fix the issue right up. If the diagnosis shows the uterine septum or scar tissue, like Asherman's syndrome, surgical correction is available to completely clear that space. And if the issue is with that vital cervical fluid we talked about earlier, or maybe chronic inflammation, doctors use tailored medication and hormone therapy to successfully restore your normal fluid, mucus, and reproductive processes. The bottom line is that there are actionable, highly effective medical options for pretty much every single factor we've discussed today.
You know, knowledge truly is the most powerful tool you can bring to your health. By understanding that cervical and uterine factors are simply physical hurdles, and definitely not failures of your body, you completely change the narrative. So what step will you take today to understand your unique fertility journey? Whether it's making a quick phone call to a specialist, tracking your timeline, or honestly just breathing a huge sigh of relief that you aren't alone in this, we really hope this explainer has given you the clarity and the confidence to move forward. Thanks so much for joining us, and we'll see you next time.